I V M.
Hello and welcome to the Habit Coach podcast. I'm Ashdin Doctor, your habit coach, and today we have a very interesting guest. This is a topic that I've been wanting to cover for ages, but I haven't had the opportunity till I found this guest. And I'm so excited to have this because, whenever we talk about habits, one of the first things people talk about is what? Brushing teeth is a habit. And I was like, yeah, but that's one of the smallest of the things that is there when it comes to our oral hygiene. And there is so much to discuss when it comes to oral hygiene and understanding our mouth per se. So with us, we have a fantastic guest, Dr. Reiyal Goveas. Reiyal, welcome to the Habit Coach podcast.
Hi, Ashdin. Thank you so much for having me. It's an absolute pleasure to be here. It's one of my first podcasts that I'm doing, so I'm also really excited. And I'm looking forward to having this chat with you.
Yay, first podcast. Love it.
Yeah.
Reiyal, can you tell us a little about yourself?
So basically, I am a dentist, as you very correctly said, but I have also trained myself in a specialization known as maxillofacial prosthetics. That's my main specialization. So that actually deals with making prosthetics for cancer and trauma victims after they've lost, parts of their face. So I actually make that out of silicone and acrylic. Okay, but that's a whole nother ball game. But what we're talking about today is the oral hygiene and how everything matters for that. And I'm also a smile designer.
Wow.
Okay, so that's on how aesthetics of your smile matter, and I guess we can talk about that as well in today's.
It's so interesting because when people think about oral hygiene, they only think about their teeth, right?
Right.
And that's where it starts and that's where it ends. And maybe brushing the teeth, maybe visiting a dentist only if there's a problem,
Yeah.
right?
So you've actually hit the nail on the head. The way our entire I would be right in saying this, that our entire society, an Indian society, okay, we only think is jab tak chal raha hai chalne do. Okay, if there's no problem, just let it be. Okay, but this is not how everything else works. We go and get blood tests done pretty often. Okay, you go and get yourself checked by your physicians. Do I need to top up on some vitamins or this and that? So why aren't we going and just getting a very rude? People think you're going to the dentist, he's going to rip you off.
Correct.
Plain and simple.
Very expensive or very painful, one of the two.
Or one of the, because the oral cavity is such that it's a very personal space. Okay, it's very private also, and it is also very sensitive.
Yeah.
Okay, it's not like you're getting a massage done or something like that where anything can go and it's fine. It's very, very sensitive. All right, so people are scared already. Like the first thing that people tell me before, hi doctor, how are you, what's your name, is I hate dentists. That's the first thing that most of my patients would say, and then you're like, well, thank you very much, but you're here now, and I don't worry, we'll sort you out. Know. So this thing of getting a checkup, okay, as a basis for checking on how your overall health is very important. Okay, and people should put this as a part of a habit. They should make it a habit to get themselves checked once every 6 months, or at least once a year. To just check and see that everything is going well. Okay, because what people think that I just have a small cavity and it's okay, it will go on. But that's one small dot. The sad thing about a cavity is that once it starts, it's not reversible. It's an irreversible process. So that small cavity, which could be just dealt with a small filling, let's say, suddenly goes into root canal or goes into you having to knock your entire tooth off, and then all of a sudden you're like, you've broken the bank, and you're like, damn.
It could have been a small fix, but now you spend so much on it.
Exactly. And so that's why these checkups, as you've mentioned, should be something that's done very frequently. Okay, and it will just help you have an overall status of your health. So then why not?
So when you do a dental checkup, what are the things that you're looking for? So like I said, that as consumers or as patients, we only think about our teeth.
Right.
What are all the other aspects of the mouth that you are looking at as a doctor?
Okay, so when we deal with it, we look at the orofacial complex.
Okay.
Oral means the mouth. Facial means your entire face as a complex. So the orofacial complex. Okay. And as dentists, so we're not looking at your eyes and nose and ears and all that. Of course, I'm not there. But what we would consider would be your jaws.
Right.
Okay. And your mouth. And now in your mouth would be included your soft tissues, which would be your cheeks, your gums, your tongue, the floor of the mouth, which is your palate on top, and the soft palate is at the back of your throat. Okay. So these would be the soft tissue, what we would look at, and the hard tissues would be the bone, which is in your jaw.
So the jawbone.
The jawbone, exactly, which is your the maxilla and the mandible, which is the lower jaw. the joint itself, which is known as the temporomandibular joint, the TMJ. So we see how that functions. And of course, your teeth.
Okay.
Okay. So, like I said, it's an entire complex, is what we look at.
Can we understand the roles of some of the important aspects of this complex?
So it's just like a car. Okay.
Okay.
If one thing doesn't function, it just has a compounding effect, and somewhere something's going to give. Okay. So for us, it's like your muscles, your joint, and your teeth. Okay. They always have to work in a synchronized manner. Okay. And if it doesn't work that way, something gives way. So either you have people who have very large muscles of mastication, which they chew with. Okay. Or they have joint issues, or their teeth are more or less broken down completely. You see them having these really flat teeth, or you can barely see their teeth because their jaw and their muscles are so strong that their teeth have given way.
Interesting.
So everything basically, and our body is brilliant at finding its own sort of a center.
Yeah.
Okay, so it likes to, if something's not working, it will either work its way around or will just get rid of that. So that's even how our mouth functions, So either your teeth pay the price, or your joint will pay the price, or your muscles pay the price.
And when you look at someone's mouth, what are the things is there a checklist that you look at first, second, third?
So we are an NABH recognized practice. We're the only one in Bombay. So this basically means we have a lot of paperwork to follow. We're just like a mini hospital.
All right.
Okay. So yes, we do have something known as a 35-point checklist.
Wow.
Okay, when you come in for the first time. So we check everything starting from the color of your teeth to the shape of your teeth to your glands. So you have glands at the bottom of your neck. When you get like a sore throat.
Correct.
Suddenly you feel like, the base of the doctor will always just press the base of your neck and be like, you've got something going on.
Correct.
So those are your salivary glands, basically. So
Okay.
they tend to get inflamed when you have an issue. So we check those. Then, like I said, we check all the soft tissues. So your gums, your tongue, your cheek, soft palate, hard palate, and your teeth. And then we take a full mouth X-ray. Okay. So in that, we get to see how your bones are and your joints are. So this is more or less as just an overview. Then in that, if we see something's off, then we would take a smaller X-ray, or we take photographs, or then we call in a specialist who has, who's narrowed down just that aspect, and then they would be able to give us a better idea as to what could we do.
So this is a question I like asking all my doctors on the podcast, which is that have you ever seen a perfect set of a perfect mouth, for example, like where there's nothing wrong with, and you're like, wow.
See, so even for us, it's like the way, or the way I like to practice is that if you find that you're happy with what you have, I don't want to mess with you.
Lovely.
So almost every mouth is a perfect mouth. Okay. If there's something functionally wrong, okay, or if something that I can see, that I can just tell you that, this is there suggestively, it's a decision that you need to take. All right. But otherwise, more or less, your body is designed in such a way that it sets everything up to function just the way it should function for you, which is perfect.
Interesting. As also, everyone thinks they have a perfect mouth because they don't come to the dentist because they're scared of them. So
exactly. Right. So that is something, like I said, that needs to change, because even though you might feel that everything's going well,
right,
like I said, it's these small things that just become a compounding effect, and then later on in life, we don't find it out right now when you're in your teens or in your early 20s, 30s, everything's going well. But the minute you start hitting your 45s and 50s, when things start breaking, as they say, or you start realizing, something's messed up, it could have been easily fixed when you were 20.
Interesting. So when is the time when people should start their oral hygiene, like, or what are the aspects of oral hygiene they should start young? Like, what are
The minute you have teeth, you start. So this is based on your parents. Okay, your parents should be looking at your babies once they start getting their teeth, or even when they have not, when they still have their gum pads, as we call them, because how to breastfeed. Even when mothers are breastfeeding their children, there's a particular way of how they should clean their mouths. So they should get used to cleaning their children's mouth, and the child also understands that they are supposed to maintain it in a particular manner. It's a very interesting way that babies tend to develop these subconscious habits.
Can you expand on this so that parents listening can probably start doing this?
So basically, there is something known as a pedodontist or a pediatric dentist. Okay, that's not my specialty, but I do have them who work with me. So the thing is, even they say that the minute you have your newborn, okay, and you want to start figuring out their digestive requirements, okay, what they're supposed to be eating. So you'll go and check with your nutritionist. You'll go and check with your gynec, your obstetrician. You go and check with all these guys as to what should they be eating, so on and so forth. But then you miss out on checking with the dentist as well.
Hmm.
Okay, so that is your pediatric dentist. Okay, so it is a must for all parents who have young kids, not just to wait for their kids to start complaining that there's something wrong with my tooth, because in children it's much more rampant. They have way more sweets than than we do. They're not as conscious about their oral health. Anything comes, they will eat it. They don't necessarily rinse their mouth every time. So for them, having a parent consciously check and to actually know that, yes, this is what my child should or should not be doing, they need guidance.
Okay.
No one's born with a manual, we have no idea.
Correct.
So a pediatric dentist or that appointment is essential, and then they will be able to guide you as to how you should take care of your child and their oral health forward.
All right. And then when you start growing up, what are the aspects of, what are the habits that people can start creating for taking better care of their health apart from just brushing their teeth? And I'm sure there are still techniques in brushing teeth that people are missing out, right?
Right, exactly. So the way a child would brush their teeth is different from
Mhm.
a way an adult is supposed to brush their teeth.
Okay.
Okay, just purely from the dexterity point of view. Okay, it's not that the teeth are different or anything like that. It's just that for a kid to do certain motions would be quite difficult at that particular age, whereas obviously an adult would be able to manage it better.
Okay.
So yes, there are different ways to brush. Okay, usually we show patients. That's why I don't know how we're going to do this on a podcast, but it's all about getting into the nooks and crannies of your teeth when you're brushing. Okay, and so one of the major habits is brushing twice a day. Okay, people, if I were to just ask you very generally, what would you say would be, if you had a choice, would you brush rather at night or would you brush it in the daytime, in the morning?
Morning.
Why?
Because that's when you want to feel fresh.
That's when you want to feel fresh. So basically, you've gone to sleep, you've woken up in the morning, okay? You've obviously got morning breath and this and that, and you want to, get rid of all of that.
Correct.
But have you ever wondered why you got that morning breath? And why doesn't it happen to you in the day? Why is it happening only in the morning?
Interesting.
Okay, yes. Because what happens is when you go to sleep, our body has a natural circadian rhythm, right? So that your entire system is now in rest mode.
Correct.
So your saliva, which is your major, how would you say, your detergent, okay, that helps keep everything clean, that washes everything out, has basically stopped function, not stopped, but has slowed down when you sleep, because your body is obviously not eating at that time. Your body is not thinking that way. Okay, so it assumes you've already had your meals. Now you don't need to, so everything goes into a sleep mode.
Correct.
Right. Now imagine you've not brushed your teeth before going to bed. Okay, you had your midnight snacks also, whatever, or you've had your dinner. All that food is nicely resting in your mouth. It's not cleaned out. You've gone to sleep. The one thing that is supposed to protect you, which is your saliva, has also gone to sleep. What's going to happen? It's a party in your mouth.
It's a free for all.
For the bacteria that's there, they're having a wild time. Okay,
Correct.
so then you wake up in the morning and you brush. Okay, if you ask me, I would say nighttime brushing is the most important habit that one person should have. You cannot go to sleep without brushing. It's just a no-no. I would even forgive you if you wake up in the morning and don't brush and go and have your first cup of coffee or drink your glass of water.
Correct.
Okay, because then your body's waking up.
Right.
Okay, it understands, and then everything starts functioning. If you already have a clean mouth at night, there's nothing really that you got to clean in the morning.
So what's the point of brushing your teeth in the morning if you brush it at night?
So brushing the point in the morning is, again, it's a feel-good factor.
Feel good.
Okay, it is a feel-good factor, fair enough. But also there's a thing that plaque, okay, which is basically your soft deposits. Okay, so there are certain bacteria in your mouth that help deposit this film on your teeth.
Right.
That over time is first soft and that becomes hard. Okay, so it goes from plaque to forming tartar, as you've seen. So tartar is what we also call calculus.
Okay.
Now, this is a stone-hard deposit that's on your teeth, which you cannot remove with a brush. It's not going to come out by you. It will only come out by a professional, aka me, cleaning the teeth.
Right.
Okay, with the scalers.
Correct.
So have you gone for a teeth cleanup?
Of course.
Personal question now, but yeah. Anyways,
the teeth cleanup. The favorite part is when you do the little mechanical brushing afterwards and
exactly
with the various toothpaste. That's the
right.
best.
The industrial cleaning.
Correct.
Yeah.
And then after the cleanup, your entire mouth feels like it has holes in it. That's the
right.
That's the
So you know why that happens? It's basically because all those little gaps, okay, and those nooks and crannies was actually filled up by this tartar, okay, which was nicely resting over there and made your mouth feel very smooth.
Correct.
And all cool and everything. But then once it's out, that area is actually supposed to be occupied by your gum.
Oh, so the gum's supposed to go up into that area.
Exactly. There's not supposed to be any gap between your teeth and your gums where food should actually go and lodge itself. It all has to be a very nice closed system. Okay, and the minute And this plaque deposit happens to everyone. It's a natural process.
Hmm.
It's just how often do you clean, how well do you clean,
Hmm.
and how often do you actually get a cleanup. Because over time, even with dentists and people who know, like even for me, I need a cleanup once every 8 months to a year.
Okay.
Why mine is that way? Because I know how to clean my teeth a little better than most people would
Right.
do. But I still would go for a cleanup or ask my associate, bro, do my cleanup.
Hmm.
Because it's required.
Right.
So for a normal person, sometimes you, depending on how well you clean, you might need to go in once every 3 months
Hmm.
or once every 6 months.
Hmm.
Patients ask, how often should I get a cleanup done?
Correct.
So there's no fixed value. It is case dependent.
Hmm.
And this the best judge for this would be your
Dentist. So the way I like to do it with my dentist is also, this is just a tip for everyone else. As soon as I go to the dentist, I fix up my next appointment 6 months from now.
Perfect.
So
That's
then it's there in
absolutely
my
perfect.
calendar and I know when it's coming. And if
Yeah.
I need to move a couple of days, then I can do that closer to the date. But then I know when the next one is. Because otherwise, you just out of sight, out of mind.
Absolutely.
Especially in these last 2 years, definitely out of sight, out of mind.
Absolutely correct.
We're going to take a quick break. See you on the other side.
Remember the days when our granny used to narrate once upon a time stories? Let's bring back the good old days of moral stories with Storytime Tamil. Hi, I am Ravishankar Balachandran, host of Storytime Tamil podcast. I would like you to entertain and educate your children with stories from Storytime Tamil. Tune in to the new episode sharp at 7 p.m. every day on IVM website, IVM podcast app, YouTube channel, or wherever you get your podcast from.
Welcome back. All right, let's jump into the conversation.
What is the role of mouth breathing at night and plaque and cavities and all of that?
So the thing with mouth breathing is basically that it causes your gums to have, you have more gum issues than you would have with the teeth.
Okay.
Okay, because what happens is your gums are not used to being dried out.
Hmm.
They're always nice and moist. And that conversely will also affect your teeth because the saliva is getting dried up, right?
Hmm.
The chance of you having cavities also increase, especially if you've not cleaned everything.
Right.
Which is the brushing. Okay?
Correct.
So like I said, it's all a vicious cycle, so in order to break that cycle, very simple habit of just brushing your teeth at night will actually take care of a lot of your issues.
Are there any other things that people need to do to like optimize their oral health? Say that they're brushing their teeth twice a day, some are brushing them thrice a day. What are the things that they can do to optimize it, make it even better?
Okay, so just like you said, some of them are brushing thrice a day. So some people even like this thing of brushing, OCD complex, that they like to brush after every time they've eaten something.
Correct.
Not required.
Okay.
That's overkill. Okay. Even though you brush twice a day, it's what kind of toothbrush you use. Okay, and what kind of toothpaste you use also.
Okay.
Okay, so let's just break it down one by one. So in order to optimize everything, okay, so first let's just go basically is brushing twice a day is all you need. After you've eaten anything or drank anything that's not water.
Okay.
You've had your coffee, you've had your tea, you've had your beverages, you've had your snacks, your lunch and your dinner, breakfast. Just drink water after, either rinse your mouth out or just drink, if you're in a social occasion and you can't visit the restroom, for example, just drink some water, swish it around and swallow it. I mean, it's not a bad thing.
Right.
You literally just eaten that, a couple of seconds ago. So you can do that. So that's one thing that will like instantly get rid of all the gunk that could be, stuck to your teeth. Second thing is, if patients have these sort of gaps in their teeth where food always gets stuck, okay, check for these things known as interdental aids, interdental brushes. Okay, and you can actually carry these. They're very pocket friendly. You can keep them in your pocket, in your purse, in your wallet also. And they're just these single tufted brushes. Like they just have one little stick with bristles on it. It's something that you just pass through your teeth.
Like the bottle brushes.
Exactly. But for your teeth. Yeah. So this is something that you could also carry with you that will help keep it clean, especially if you're having a lot of, if you're on a very high fiber diet, if you're having a lot of veggies and raw salads, mutton, chicken, especially, these tend to get stuck in these odd places.
Mutton is the worst.
It irritates people. Yeah.
Correct.
And this would really help keeping it clean. After this, coming to what brush should you use? Okay, so it should be either a soft or a medium bristled brush.
Okay.
Okay, so some people, if they're used to brushing with a hard one, they suddenly might feel that I'm not effectively cleaning my mouth because wo feel nahi aa raha hai,
Yeah.
I am not feeling good. But your brush is not a bathroom tile. You don't have to go at it. Okay, a soft or a medium brush is actually going to do its job. Okay, it's how you use it is what's important. It's not how hard you use it.
Interesting.
Okay, so that is something you need to check with your dentist. They need to show you how to brush. There's nothing wrong in asking, how do I brush? It's really it's not rocket science, but you need to be told at least once.
And they'll bring out a very cool looking model of your teeth and show you on that.
Exactly. So we like that opportunity to take that guy out also, now and then. So it's worth it, Mine's called Andrew, so I like taking Andrew out in the clinic now and then. Yeah. So it's fun.
How often should you change your brush?
So they say between 2 to 3 months. Okay. Or once you see the bristles start fraying, that's when you should actually get rid of the brush, okay, and change it out.
So again, this whole thing about they say, the companies say that we should do it every 2-3 months. Is there like is there any truth to that aspect of it, or are they saying that just buy more toothbrushes? This is what people think, right?
No, so 3 to 6 months is actually a good bearing to change your brush, okay, because you'll actually see the bristles start warping. Okay, and that's your indicator, because then it's not working effectively.
Correct.
So that's what you would need to do.
All these new fancy bamboo brushes, charcoal brushes, this, that, what do you suggest?
So see, the main thing is this entire charcoal movement. No, I think for the teeth and all of that is absolute nonsense. Okay, especially you can't put charcoal in everything and expect it to work. It's not meant to be. Okay, just a regular toothbrush, like I said, soft or medium is what you need. And in terms of toothpaste, also just your regular Colgate. Okay, the plain one, not your gels, especially not the Ayurvedic herbal toothpaste. Okay, I know they are a rage. People really like using them, but you would have realized that why do you actually feel your teeth are so clean and so brushed down, or after you use that paste, because it has very coarse particles in it.
Okay.
And it's not following any sort of recommended ADA, recommendation or any guideline for its formulation. And they're also sometimes using banned ingredients like triclosan and stuff like that, which is not supposed to be in toothpastes.
Right.
Okay, so it's not something we recommend. So just your very basic Colgate, okay, with your toothbrush, okay, is what you need to do, and you will be sorted.
Okay.
And then even all this the rinsing with coconut oil pulling and all these things. There's no actual scientific data to show that it actually works.
Okay.
As a feel-good factor, and if you want to do it, there's really no harm doing it.
Right.
Okay, but if you're asking me as a doctor, would I actually prescribe it to you for some actual benefit that you would see? We haven't got any data to substantiate that.
Interesting. Because whenever you do the oil pulling, your teeth feel nice and clean, and you have that kind of a smooth feeling in your mouth.
Fair enough.
So
like I said,
it's fun for
factor.
that.
Yeah, feel good factor. Now coming to that, so even your mouthwashes,
right?
For example, okay. So some people, a lot of people say, if I use a mouthwash, I don't need to brush. Okay, the most common thing, I just rinse my mouth at night with my mouthwash and sleep, but morning I wake up and brush. Okay, I would do it the other way around.
Ulta, correct.
I would do it the other way around if you really need to. Okay, spend those 2-3 minutes on yourself for brushing. Okay, this is the time that you should brush for. About 2 to 3 minutes is good. It seems like an eternity. Everyone says, yeah, I brush for 2-3 minutes.
No
Actually,
chance.
put a timer.
45 seconds.
Timer. Yeah. Put a timer and see what 2 minutes feels like. You'll be like, oh my God, this is so long.
Yeah.
Like I've done it once and I'm like, yeah, I think I brush for that long. I actually so we get the electronic brushes, that come with timers now. I'm like, this is not switching off only, man. It's
broken.
Spoiled or something. Is it broken, or did I break it before I even started using it? And then it switched off. I'm like, oh shoot, this is 2 minutes. So it's actually a long time, but that's the amount of time you should effectively use to brush your teeth. All right. And after that, flossing. Okay. So flossing is something that everyone overlooks. No one really does it right. Or they just feel it's not required. But if you realize 40% of your teeth surfaces are in between.
Correct. So which don't get cleaned ever.
Yeah. How would you clean them? How would you get in the middle? How would your brush is not going to go there. Okay. So you need to floss. Okay. So it does take it's a learning curve. I understand, but you need to effectively start practicing that. And it's not like you need to. So what we would say is you need to floss at least 4 to 5 times a week. I'm not saying floss every single time twice.
Hmm.
It's not required,
Hmm.
but 4 to 5 times a week. And especially for those people who realize they've got some problem areas where always food gets stuck.
Interesting.
So if you have something like that, then that must be cleansed every time, because food is effectively actually getting stuck over
Right.
there.
Hmm.
Yeah, but otherwise 4 to 5 times a week and you're good to go. It's not a major deal. So this is what I would say would keep you going. Brushing twice a day, flossing, using the right kind of toothbrush, toothpaste, mouthwash if required.
Mhm.
Okay, and just rinsing your mouth after you've had anything that is not water.
Okay. Interesting.
They should keep you good.
What about the soft tissues?
So for the soft tissues, they say that if you floss and if you keep your oral hygiene good, the soft tissues are good to go. Okay. The only time the soft tissues start having a problem is if they get traumatized, of course. So like if you've had something very coarse in your diet, or if people have bones sometimes, or if they have some sharp object and it hurts it,
Correct.
and you get an ulcer or something like that, then that is when you need to be a little bit more careful. But in everything else said and done, you should actually check your soft tissues. This is especially true for a lot of people who have supari, a lot of people who have your tobacco products, smokers, okay, all these things. You should be constantly checking your gums and your cheeks. Okay, because if they start looking off, or they look odd, or they don't look pink anymore, and they're starting to gray out, getting whitish patches on them, something's off. Okay, that's not the way it should look. That's not normal. If you are not sure if this is normal, just check your partner's mouth. Just check someone in the family. Just Google an image of what a clean mouth should look like. If yours is not matching that, please go and get it checked. Something is not right, and you need to either stop your habit or you need to get something checked out. So that's what
What are
I
the
would say
main
for your
problems
soft
that you would
tissues.
typically see with soft tissues? Like I know people end up biting the sides of their cheek and have tongue issues and things like that. So what are the things that you would typically see?
So the most common is having a gum issue.
Okay.
That is your most common thing, and that's again purely related to hygiene. Okay. So what happens is, the thing about gum problems, it's not like a cavity or where suddenly your teeth get sensitive, and you start getting pain in the tooth. That's not how gum issues are. Gum issues are more chronic. So it's like they'll keep happening slowly. You won't realize it, and all of a sudden, no, it's gone downhill very
Fallen
quickly.
off a cliff.
Basically, and your teeth actually start shaking, and that's when you realize that, okay, and it only started from a gum issue. It's not a tooth. The tooth is actually pristine. There's nothing wrong with the tooth, but it's because your gum has sort of given up. Underneath your gum is bone. So after your gum's gone for a toss, then your bone is bearing the brunt.
Right.
And then your bone also tends to give way, and ultimately the tooth can literally just come out into your hand. So
You can just pull out a tooth like that if the gums.
literally.
Okay.
Yeah. So we've done extractions in the chair where literally the chair is up. We put the forceps in, we pull the chair down, the tooth is hanging.
Weesh. Wow.
It's like that. So it's that loose. You could literally pull it out with your finger.
Right.
So, and even then the patient's not in pain. So imagine. So
the nerves have gone for a toss.
everything's gone. No? So it's very minimal, and they don't realize it. Okay. So gum issues are something that you need to get checked out. And it's something as simple as just good oral hygiene and a cleanup that can save you a world of worry.
With the gums, especially.
With the gums.
Okay.
Yeah.
Lovely.
And in terms of your cheek biting and so on, so cheek biting usually occurs because either your teeth are not in the right position. Okay. So because they're off from their alignment. Okay. Whenever you tend to close, your cheek is sort of getting entrapped. Or the most common culprit are your third molars, the wisdom teeth, as we say. So funnily enough, it's actually proven that the wisdom teeth, since they've been extracted so much and they're actually becoming redundant, people being born now are coming out with only a set of 28 teeth and not 32.
Oh, really?
Yeah, because it's just going into redundancy now, and we're getting smaller jaws. Okay, as human beings, as an evolving species.
Correct.
So the third molars are actually becoming more and more redundant, or they're being buried in odd places, causing havoc on the other teeth.
Absolutely.
So getting this checked with a full mouth X-ray, that's the only way you would know.
If this is
The
causing
only way you'd know. Okay,
Interesting.
suddenly you'll realize, and many people wake up one day, they'll be like, my teeth did look like this a month ago. Suddenly they've shifted a bit, like what's going on? Then they go and check, and one X-ray shows that your third molars have decided to move a bit, or they're erupting. and you need to do something about it. So checkups. That's it.
Checkups are critical.
Yeah.
I was reading somewhere about this, that the entire jaw of the human body is changing, right? And the entire mouth is changing and the structure is
Exactly.
changing because we now have cooked food. So we're
Ah,
not
yes.
chewing on things,
Exactly.
and hence
Our diets are softer.
our diets are softer,
Mhm.
and hence the entire body is changing. The teeth are changing, and our nasal passage is changing because of the teeth.
Mhm.
Do you think we should start eating harder food? Like, are there things that we should start doing now to make a change? That chewing
I
gum,
I don't think these hundreds of years of changing suddenly by us eating hard food is going to go back to getting bigger jaws. But it's just a part of the evolutionary process, no? That's like I just told you, like suddenly now we have 28 teeth instead of 32.
Correct.
Right? So this is just another change that's happening. You also would have realized that just in terms of the entire human species, also our heights have changed now. Our lifespans are different. All these things are changing, so it's bound to happen. And but the only thing is that maintaining it is what's important.
Right.
Because no matter how advanced dentistry has become, what we used to do even 5 years ago, the materials we used and what we're using now, there's actually a huge difference.
Yeah.
But nothing can beat biology and what you have, and if you can maintain that, nothing like it. You don't. I don't need to be doing fillings for you or any of those things. So
people go through life without ever going through a filling.
Trust me, I've seen 60 and 70-year-olds, they have come in and they've never visited the dentist, okay, and they've actually got very good teeth.
Interesting.
But so there are two types of variants of people also.
Okay.
One who have weak teeth but very strong gum. Right, so they have more of your cavities, more dental issues, but not so much of gum issues or periodontal problems. So the gum complex is known as the periodontium. So we call them periodontal problems, so periodontal issues. Whereas the other end of the spectrum is people who have excellent teeth, but they have very poor gums.
Okay.
And so for these people, then we would tend to refer them to a gum specialist known as a periodontist, who would put them on a regimen, and their cleanups would be a little bit more frequent and stuff like that. And this is the way then we would.
Is it a nutritional deficiency also that causes gums to not grow and be?
Absolutely. So just like an overall, so your vitamin checks, okay, so your full body profile, it actually affects your tongue. Your tongue will represent itself in a different manner if you're suffering from a particular kind of deficiency.
Right.
So if you're dehydrated, your tongue will look different. Okay. If you have especially vitamin D, which most of us do.
Right.
Okay. Vitamin A deficiencies. So all these things manifest first in the oral cavity. So, getting that checked by your dentist, and if they know what they're looking for, they can actually tell you, you should go and get a full body profile done. You possibly are suffering from something else. We can find out if you are bulimic. Okay, we can find out if you have GERD or gastric reflux.
Bulimic, why? Because of
because you're continuously
vomiting.
You're sort of throwing up, right? So that the acid from your stomach is actually affecting your teeth in a different way.
Interesting.
It actually burns through your teeth also. And gives it a different kind of wear pattern, right? So that's what we're able to identify. Same with reflux, so people who keep having acidic sort of the stomach acids that keep coming up, their teeth get affected.
Correct.
So we're able to identify these things, So just a simple checkup can actually save you from a lot of other issues.
Are there any food and lifestyle issues that we can start thinking about in order to have better oral health? Like I was reading somewhere about how the first dental issues were seen in the Egyptian civilization, because those were the first civilizations that had wheat, for example, and they've associated these two. So I'm saying that are there things like that exist, or are they just good news?
Right. No. So that's absolutely correct. So like, not to break it down, but a lot of like different sects and communities like to have particular foods more than others.
Correct.
Right. So having a very soft diet, having a very sugary based diet, or having a lot of sweet foods with all your food that you're having all the time is a definite no, not only for your teeth, but also obviously for your general health.
Correct.
Okay. But having foods like cheese. Now, no, this is not processed cheese. I'm talking about the good stuff. Okay, if you're having good cheese, you're having fibrous foods. Okay, your leafy salads. All these things also help keep the mouth clean. And also, see, the more you work something, the better it functions. Not overwork, just work it. Right. So having foods that actually help you chew. You're not always just eating through a spoon.
Correct.
Okay, you're not drinking all your foods.
Hmm.
Okay, you're actually chewing, you're making that effort. So sometimes having raw and unprocessed rice, for example,
Hmm.
okay, or having your rotis, your chapatis and stuff, where you're actually chewing, not bread all the time.
Right.
Okay, not soft bread.
Hmm.
Okay, if you're actually having your proper, like your sourdoughs and stuff like that, yes, but how in the general public, how many people have sourdough bread for every meal?
Correct.
It's not our diet.
No.
Right? But having rice, for example, don't have it processed all the time. Sometimes go ahead and have it unprocessed or unpolished rice, as they say. Or having more fibrous foods in your diet will definitely help.
Yeah. In fact, I do this with my dad as well, because as he's getting older, he keeps complaining about, I have to chew so much, you don't understand, I have only so little teeth left, and those kinds of things. And I was like, no, but the more you chew, the better it is for your health. So don't think about just thinking of all the soft food that you can eat on the table. Think about all the variety of food that you can eat on the table.
Yeah, absolutely.
Right? Making sense. Lovely.
Absolutely.
Is there anything that you want to leave our audience with as a thought that they can take home? Is there a habit that you wish everyone did, or your patients came to you saying that I do this, and you'd be like so proud of them?
Just two things, Ashdin. One thing is the nighttime brushing. I can't emphasize that. And I think, when people hear this, they'll understand the importance of it. And flossing. Okay. These two things, if you actually inculcate into your nighttime routine or your daily routine, as you would say, it's going to make a world of a difference to your oral health. And even you'll understand a lot more about how your own mouth functions. Okay. So you'll understand a lot more. You'll know when something's off. So it's not necessarily that it has to hurt you before you need to go to the dentist. You'll be like, I used to do this and now it's not feeling the same.
Correct.
So it makes you more aware of your own mouth, for example. So that is one thing. And the other thing is just get a consult, just go and talk to your doctor. Just go and see a dentist once. And then if you've got the right one, and if you're able to identify certain factors, work on them, and it'll just make your life so much more better.
Beautiful. The flossing habit is something that the companies have been desperately trying to figure out how to make as a habit for people. And 2-3 things that I've found that are very effective in making people floss. One is, please don't hide your floss in your cabinet. Right? Keep it out and prominent so that you see it when you're going to brush your teeth. That is the first basic step that you can do. The second basic step is that every week or so, when you realize that you stop flossing, change the position of the floss, because it becomes a blind spot when we see it. So change the position, and then at least it acts as a reminder to pick it up and start flossing.
Absolutely. And it's also a great mental exercise also for dexterity. Also been proven to show that it helps with Alzheimer's, is that if you brush with the right hand, you can start brushing with your left hand on some days. And
switch it up.
Yeah, switch it up. So it actually fine tunes your brain on the finer senses and the dexterity level, So
Correct.
If you're right-handed and you always brush with the right hand, try brushing with your left one day and see how hard it is, first of all, and see that, it actually makes a difference.
Totally. Your mind explodes.
Yeah. So, mind blown.
Mind blown. I tried once shaving with my left hand, and it lasted all of it.
Did you shave or did you
shave
was it a bloodbath?
Probably just cut off my skin. But so I think switching it around, have fun with your dental care. I think that's the most important thing. People just see it as a chore. Don't see it as a chore. Think of it as an investment.
So even, just sorry to cut you off, Ashdin, but even one thing, Ashdin, that if flossing is a task, you also get something known as water flossers. Okay, for those people who really, really don't do it for the sheer fact that they can't, or they just can't manage, or they're not liking it at all. You also have something known as a water flosser. That's basically like a jet spray for your teeth.
Correct.
Okay. So it basically shoots a very fine jet of water that you basically, it comes with a tip that you place in the middle of your teeth. You press a button, it shoots that water, and it cleans in between. So it's not as good as flossing, but it definitely is much better than not doing anything.
Absolutely. Better than nothing.
This is something that people could also use.
Doctor, how can people get in touch with you, continue this conversation? What are the ways in which that people can reach out to you?
Okay, lovely. Thank you for asking. So we have an Insta. So the clinic I'm at is called Therapeuo. It basically means wellness in Greek. We kind of messed up on the name because it's a very confusing one. So people are like, why didn't you go with gentle dental or something with dental in it? Tooth fairy or something like that. And we're like, yeah, I'm sorry. We kind of messed up on that one. But it's called Therapeuo.
Can you spell it?
Therapeuo. Now you know why it's
got it.
confusing. But yeah, it is what it is. So Therapeuo Dental and Multi-Specialty Clinic. We have an Instagram page. We're pretty active on that. We have a
Which
Facebook
is called?
profile. It's called Therapeuo Dental.
Okay, perfect.
That's the Instagram page. Facebook also is Therapeuo Dental. You can check us out in Google. And we have a website also, it's therapeoclinic.com. And I've also recently we've launched a new website called Mumbai Smile Design.
Lovely. Much easier.
So it's Smile Design Mumbai.
Smile Design Mumbai.
Smile Design Mumbai. So it's just recently launched. Please go check out the website. It's all there, and we're doing smile designs for free.
Wow. Okay, perfect. Done.
Yeah. So you can just go send us a couple of photos. We've given you a guideline as to how you're supposed to send it in, and we'll do your smile design for you for free and send you back a photo. And if you like it, we can have a chat.
I'm damn curious about this. Okay, done. I'm going to try this out. Thank you so much for coming on the Habit Coach podcast. This was an amazing conversation that we had. Thank you so much.
Absolute pleasure, Ashdin. Thank you so much for having me.
So start these habits and share with us your progress using the hashtag #TheHabitCoach. If you like this podcast, don't forget to check out other interesting podcasts on the IVM network. You can listen to us on the IVM Podcast app or ivmpodcast.com. You can also follow us on social media. We are at IVM Podcasts on Twitter and Instagram. If you want to reach out to me, I am Ashdin Doc on Twitter and Instagram. You can find lots more information on my website, awesome180.com, or check out different content on my YouTube channel called AWESOME180. That's Awesome180.
Hey everybody, it's been another great week on the IVM Podcast Network. On Wars and Warriors, Air Vice Marshal Arjun Subramanian takes listeners on a trip with the race to Dhaka and some of the most crucial moments from the lightning campaign of Bangladesh. On Think Fast, Varun and Suchita drop some hot takes on NFTs, music, and the rise of social commerce. On Ikaduka Economy, Abhinav Trivedi and Dr. Bharat Junjunwala, author and ex-professor IIM Bangalore, discuss war and its effects on our daily lives. On Shunya One, we spoke to Reiyal Goveas. He's a partner at Stellaris Venture Partners. We discuss why SaaS works well for India. And on All Things Policy, the Takshashila folk discuss Australia's anti-trolling bill aimed at making social media platforms safer, but perhaps a little less private. Do follow us on social media. We're IVM Podcast on Twitter, Facebook, Instagram, and LinkedIn. And also do check out our YouTube channels. We have a number of them. You can get them on ivmpodcast.com/YouTube. And remember, if you're enjoying this show, or any of our other shows for that matter, please do tell a friend. It really does help us spread the word. And finally, we'd like to thank our sponsors for the network this week, Cred, Bank of Baroda, CoinSwitch, Kuber, Intel, and Oxfam India. Thank you so much for making this possible.
Eventually, you'll see the end of your childhood,
get accustomed to womanhood,
enjoy the experience of sisterhood,
might get to wifehood,
or not, choose motherhood,
or not. You'll learn to define your personhood,
earn a livelihood,
change the neighborhood,
and get rid of the falsehood that life post-academia is easy.
So join me, Natasha,
and me, Ayushi,
on a journey from station starting point
to station, what now?
Next station, Pudin station, and hopefully, Agla station, adulthood.
Fresh episodes out every Thursday.